of us have had an oops moment. Maybe you laughed too hard, sneezed unexpectedly, or jumped on a trampoline and leaked a bit of urine. For many women, that happens regularly. If it sounds familiar, you're not alone, and you're not doing anything wrong. Stress incontinence is incredibly common, especially in women, but just because it's common doesn't mean you need to put up with it. And in this video, we'll talk about what stress continence is, what causes it, the signs to look out for, evidence-based treatment options, self-help strategies, and a common myth I hear in clinic all the time. Stress incontinence is when you leak urine during things like coughing, sneezing, laughing, or lifting something heavy. It's not your bladder that's weak though, it's the muscles around it. Think of your bladder like a balloon, and the bottom of the balloon is a little opening. That's the urethra. It lets the urine in and out when you go to wee. These organs are supported by pelvic floor muscles, which are a bit like a sling, supporting and holding everything in place. When you cough, laugh, sneeze, or jump, the pressure pushes down on the balloon. And it's that supportive sling made of your pelvic floor muscles that's stretched or weakened, and it can't hold the bladder tightly anymore, so a little urine leaks out. So what causes it? Childbirth, pelvic surgery, and menopause can all be causes. But age, lifestyle, and things like caffeine and alcohol can also all play a part. We often see stress incontinence in middle-aged women, especially around the menopause, but it can happen earlier, especially after multiple pregnancies. So let's talk about the symptoms. The most common is that sudden, unexpected leak. You just feel it go. You might also notice leaking during physical activity, needing to wee more often than usual, or not fully emptying your bladder each time, and feeling like you need to go soon after you've just been. It is normal to go to the toilet 6 to 8 times in 24 hours, with a gap of 2 to 3 hours between each wee. If you're going more often than that, especially during exercise, it's worth getting checked. But now for the good news. There's a lot we can do. We usually start with the least invasive option, which is pelvic floor muscle training. It's as simple as squeezing the muscles in your pelvic floor, which run from the vaginal opening to the rectum, and then releasing them again. That's 1 rep. We recommend 10 to 15 repetitions 3 times a day for at least 3 months. Pelvic floor training really works. 2 in 3 women improve, and 1 in 3 women may become completely dry. Getting the help of a physio is a good idea though, to make sure you're doing them correctly. Lifestyle tweaks alongside pelvic floor training can really help too. And this means keeping a healthy weight, avoiding smoking and managing any coughs, preventing constipation, cutting back on caffeine, alcohol, and fizzy drinks, as these can really affect your bladder. And if these don't help, there are other medical options. And these include topical estrogen, which helps strengthen the tissue after the menopause. There's a medication called duloxetine that can be used to tighten your urethral sphincter, which we save for cases if surgery isn't suitable. Pessaries for people who have prolapse-related incontinence. And urethral bulking agents, which are injections that can help the urethra close more tightly. And there are various options for surgery, and these are usually long-lasting and effective. One thing I hear all the time is, I've had kids, so of course I leak a bit, it's normal. And it's common, but it's not normal, and it's not something you have to live with. There are treatments that work, and the sooner you start, the better the results. If you're leaking when you laugh, sneeze or exercise, please don't just put up with it. Talk to your GP, ask about pelvic floor physio and other treatments that may be available for you. Thank you for watching, and if you'd like to know any more about bladder health, please have a look at our series of videos below.